August 13th and 14th. We need your help. Make plans to be there for the kids.
The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Joining me is Brad White of Compounding Pharmacist. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our socially distant technical producer, J.D. DeAngelis. We continue our shows from our administrative offices and wish our friends at WHBC and our listening audience continued good health. Today, our guest is Dr. Maurice Chung, Director of Mercy Medical Center's Department of Endometriosis, Pelvic Pain, and Urogynecology. Good morning, Doctor, and welcome to the show.
Good morning, everybody. I'm glad to be here, and what a wonderful day.
Yes, it is.
Researchers are not exactly sure how many women in the United States have chronic pelvic pain because it's often linked to other disorders such as endometriosis. Chronic pelvic pain may be misdiagnosed as another condition, making it very difficult to estimate the reliable prevalence rates for pelvic pain. According to one study, about 15% of women in childbearing age in the United States have reported pelvic pain that has lasted 6 months. This morning we're going to talk with Dr. Chung about the symptoms, diagnosis, and treatment of chronic pelvic pain. We'd like to remind our listeners that our program today, like all our programs, is available on our podcast, and you can download that from your favorite podcast app in the App Store. Just look for Health Matters with the Medicine Center Pharmacy, and please subscribe.
So, Dr. Chung, I know you've been on the show before, but why don't you give us a repeat on about yourself?
Hey, thank you for having me back to the show. What about myself? Well, okay. I'm new to this area. So far that I've been in Canton for about 1 year and maybe 10 months. And I started my practice in Ohio for 30 years and I moved here. I went to undergraduate in Northeastern University College of Pharmacy and finished up with my Bachelor of Science in Pharmacy degree and went to Tufts Medical School, and here I am. I'm a doctor working for Mercy, starting up as a director of the endometriosis, pelvic pain, and urogynecology.
So, what exactly is a urogynecologist? Our listeners might not be familiar with that term.
Yeah. The obstetricians and gynecologists in women's health, then you have to further your study and training to be a urogynecologist, such as someone who deal with cancer, that's oncologist, those who deal with trying to help patients to become pregnant, and those are high-risk obstetricians. And urogynecologists is somebody who deal with mostly pelvic pain, pelvic organ prolapse, urinary incontinence, like leaky bladder, the organs falls out, and that's the urogynecology arena.
Okay. What conditions do you specialize in at Mercy Center for Endometriosis, Pelvic Pain, and Urogynecology?
Well, as I said before, a urogynecologist deal with pelvic organ prolapse, like, for example, the womb, the vagina organ fall outside of the vagina, so they kind of protrude it out. The bladder falls down, the rectum pushes up, and also with the leaky bladder, when you cough and sneeze, the urine come out. Or when you have to go to the bathroom, you cannot make it fast enough to go to the bathroom and you wet your pants. Other than that, other conditions such as painful sex, painful menstrual cycle, heavy uterine bleeding, the bladder pain, the lower pelvic pain, and also the condition endometriosis, which I have dealt with for the last 30 years by minimally invasive surgery. Endometriosis is something that where the tissue of the womb somehow that found to be outside of the womb inside the abdomen. So every time when patients have a menstrual cycle, the area started to bleed and causing a lot of pain and cramps. So these are the conditions that are dealt with.
Okay. What exactly is chronic pelvic pain disorder?
Chronic pelvic pain meant pain below the umbilicus, which is your belly button, that you could have once a month started to be hurting so bad, or maybe it's constant, that every single day. And any of these conditions that lasted for 3 months, and sometimes it's excruciating. So endometriosis is part of the chronic pelvic pain. Interstitial cystitis, they have pain, and is chronic pelvic pain because they're kind of constant and lasts for a long, long time. Of course, there's always the sentinel event that started it, but they never went away. They just get worse and worse and worse. And sometimes lower back pain too, because the pelvis connected to the lower back, and the lower back pain sometimes also kind of lump sum into the pelvic pain as the musculoskeletal pain.
And this is a pretty common condition, isn't it?
Oh yes, it's very common. It's just our physician that was trained in the residency program, they were not taught this very well. And you just have to know how to ask the question, and the patient could tell you that. And for example, when a woman come in, they say, oh, I'm hurting in my lower middle abdomen, sometimes the right side, sometimes the left side. But that could well be because of the nerve are compressed in the pelvis. And so the symptom that the patient brings in is pain. So it could be nerve pain for once. And it's very common since endometriosis affected by 15 million, at what you were saying, there are a lot more patients with chronic pelvic pain.
So, what are the symptoms of chronic pelvic pain disorder?
Well, it could be, for women, it could be painful period, menstrual pain, and that lasts for more than 3 months. They never went away, even the cycle was gone, like stopped. Bladder pain, which is in low pelvis, that patient may have urinary urgency or frequency, and they may leak urine too, but it's painful if they don't go to empty the bladder. Bowel.
How about the risk? Can you put the risk factors into this?
Well, for endometriosis, well, there's so many of them, okay? Let me put it this way. Somehow the nervous system, once they started to show the signal of pain, and somehow that person, the signal never dropped. Is it something to do with the central nervous system? We don't know. So the symptoms is for the menstrual cycle. Patient will still have menstrual period, could be menstrual cycle pain. For those who have sexual intercourse, sex may hurt, sitting might hurt. If they don't go to the bathroom, it hurts. And sometimes bowel movement hurt. And standing and sitting, they both hurt. And so there are so many different symptoms because there are so many systems involved, such as the reproductive system, the urinary system, the skeletal muscular system, and the neuromuscular system, and the bowel. So the symptom is so broad, you just have to tease them together. That's why it requires extra knowledge on this particular field.
So, is there anything that a patient or our listeners can do to prevent this? What are the chances of I mean, percentage-wise, how many women have this disorder?
All the women. Well, for endometriosis, I think it's genetic, so that's one part. But let's say the genetic causing this endometriosis to be outside the abdomen, and they have menstrual cycle, and every time they have the period, they hurt so much. But then the brain get a signal, but the brain doesn't stop the pain and actually elaborate and make it hurt more. So this kind of continue, and so that's the menstrual cycle started, the menstrual pain, and endometriosis could be part of it. And for example, bladder symptom, you have urinary urgency frequencies, and those type of individual, if they don't go to bathroom, they hurt so much. So every time they feel that they have to go to bathroom, they empty the bladder, and for the severe one, that they have to go to bathroom 60 times in an hour. So to empty the bladder so that it doesn't hurt them. So that's another one. Sitting hurt. The symptom for that, it could be nerve injury from childbirth, which is a big one, that the pudendal nerve and the pelvic floor muscles, they were torn during childbirth, and then somehow there's a sentinel events and then make that pain started and never stopped. And patient had a fall, hitting the buttock and injured some of the sacral nerve in the back, and then they could start this pain. So it's so difficult to say what are the risk factors. The risk factor is somehow that maybe genetically patient predisposed to this pain. Some patient they feel more, and some patients are more stoic and they feel less. And so these are the variant.
So is this disorder tissue destructive, or can the patient just take pain relievers?
I have some. I could not hear too well. Sorry, with the background noise. Could you repeat the questions?
Yeah, I'm curious as to whether this disorder is tissue destructive, or can you just treat this disorder with pain relievers?
Well, yes. Endometriosis is tissue destructive. And interstitial cystitis, that it's a bladder that's somehow disrupted by certain type of inflammation. And I don't use narcotic to treat this pelvic pain patient. I treat it as a problem for the nerves, the bladder nerve, the muscle and pelvic nerves. And menstrual cycle with endometriosis is a different story, and it's a surgical disease that you need a very good surgeon to remove all the endometriosis. The medication on the market, I don't use them much. Even though there's a new oral medication, I use it selectively. And medication has not been very well to use to treat the pelvic pain. Injection, anesthetic, injection, nerve block tends to be better options.
Okay. Maybe we should take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
2002.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Dr. Maurice Chung, Director of Mercy Center of Endometriosis, Pelvic Pain, and Urogynecology.
Okay, doctor, can men have chronic pelvic pain disorder in addition to women?
Yes, absolutely. But men, I feel that they are poor soul. Why is that? Because no specialty really dealt with men. Either men don't want to complain about it. Women, at least they think that everything in the pelvis, they go to the gynecologist, at least to start. But for men, where do they go? A urologist. Well, urologists tend, I'm not speaking for professionals, but I'm saying that most of the urologists like to deal with the prostate and the genital organ, the kidney, the ureters. But talk about pain, that is not something that they like to deal with. And men's pelvic pain could have the same problem, like the skeletal muscular disorder, interstitial cystitis, which is a painful bladder. When you have to urinate, if you don't go, it hurts. Or they have trouble peeing. So in men, if they have trouble in peeing and they hurt, then most of them will be classified that as a patient with prostate enlargement. And then they end up having surgery, which had nothing to do with interstitial cystitis, urinary urgency, and frequency. You see what I'm saying? And for the bicycle rider, they develop pudendal nerve pain, and pudendal nerve pain it's pelvic pain, the same as in women. So for men, it's not easy to find any doctor to take care of them. There are only a few urologists, and some institution, they have some doctor that take care of a male pelvic pain. But just to get there, I think it takes them too long, so the diagnosis was delayed for so many years.
So what about the diagnosis? How do you arrive at this diagnosis?
Well, as I said, the chronic pelvic pain involves the entire pelvic organ. And the patient might have endometriosis, so that would give them menstrual cramp, right? A patient who has symptom of the bladder they would have urgency and frequency. And for those patients have bladder pain, the muscle usually involved, so they have muscle spasm. And if they have happened to have childbirth injury, the pudendal nerve, the muscle, they're torn. So you see, that's the difficult part of it. They involve with so many symptoms of so many different systems of the body, including the bowel. Many of them, they have a loose stool and then constipation. What do we have to say about that? That's irritable bowel syndrome, right? So yeah. I do have an algorithm. So I can either include all the systems that affect the patient and treat one organ system at a time, or exclude the system. But they seem to spread the news. If the bladder hurts, the muscle hurts. It's a refer pain. And when you have pain in the pelvis, and then when you end up with the painful cycle, then during the time you have menses, everything hurts. And that's why some of the patients, when they have the symptom of menstrual pain and cramps, we thought that they have endometriosis. When you come to surgery, you cannot find any of them. So I'm not trying to confuse people, but it is confusing to begin with.
It's interesting that there's so many systems involved in this disorder.
And yes, exactly. The system kind of spread, and the pain spread. Let's, for example, I use an analogy in a neighborhood. Okay, so let's, for example, the uterus is your home. And
okay, doctor, we got to take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Partly sunny, nice day lined up for tomorrow. The high near 84. Clear to partly cloudy Saturday night, low 62. Partly sunny, warm and more humid Sunday, high 87. Clouds and sun, we could see a shower or thunderstorm on Monday. Look for a high Monday at 89. Tuesday, a shower or thunderstorm, the high 84. I'm Steve Williams for News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing chronic pelvic pain with Dr. Maurice Chung. We've got a lot more to cover this morning, so let's get back to the show.
Okay, at the break, we had a question come in from Facebook from a listener, and Dr. Chung we'd like you to see if you could address this for the patient. The question was, can this happen after a hysterectomy with bad endometriosis?
Yes. So first of all, I'd like to know why the hysterectomy was done. Was the hysterectomy done for menstrual pain and pelvic pain? And endometriosis, we know it's a disease that happens on outside of the uterus. So to treat endometriosis, you don't necessarily have to remove the uterus, but you absolutely have to remove all the endometriosis in the abdomen. So if those endometriosis were not removed and the hysterectomy was done, of course, the endometriosis itself can cause the pain, and it's not done yet. And patients with endometriosis, 30 to 87% of the cases, they do have chronic pelvic pain. So that means that other systems also involved. They could have urinary urgency frequency, such as when I published a paper back in 2002, 2005, we talk about the evil twin, the interstitial cystitis, the patient urinary urgency and urinary frequency symptoms on top of the endometriosis, so the bladder hurts. So the perception of the pain in the lower pelvis could be the bladder pain, the muscle pain, and this could be the pudendal nerve pain too, because it could be like they have childbirth and then the pudendal nerve was injured and all the pain signals spread to everywhere. And if I have not used analogies, the uterus is your home, the bladder is your neighbor, the rectum is your neighbor, the muscle and nerve is also your neighbor. So if your home is burned on fire, then the neighbor also catch the fire. And if the fireman come and put off the fire of your home, the neighborhood is still burning. So the pain of the hysterectomy with endometriosis is pretty much that the underlying condition was never addressed.
Okay. So what type of therapies, you've mentioned some medications already, and other procedures are used to treat these different aspects of chronic pelvic pain disorder?
So let's separate it into four systems: the muscle and the nerve, the bladder, the bowel, and the menstrual cycle. Endometriosis menstrual cycle, that the menstrual cycle can be controlled by hormone. Endometriosis need to be controlled by surgical removal. The bladder symptom with urgency frequency, sometimes they just have pain. They cannot tell whether that is urgency or frequency. That's a diet control, no acid, no spicy food, treating the bladder with some medications, and maybe some procedure that helps. And when the bladder hurts, most of the pain refers to the neuromuscular system. And we do have some muscle relaxant that would do it, or we have physical therapists that actually help out with the myofascial pain, which is the muscle spasm of the pelvic floor muscle. So physical therapy helps out a lot on that account. And as far as the bowel, then you need to control the cramps and the IBS. So Medication for endometriosis, there are some, but I have not used it much. For the bladder, there's a few medication that's what's helpful. Most of those are anesthetic. And for the muscle is muscle relaxant physical therapy. And as far as the nerve goes, you need to use the nerve blocks.
Okay. Okay, so let's talk about, you mentioned some painful bladder. How does that fit in with the chronic pelvic pain disorder as a whole?
So painful bladder is the same, almost the same as, well, it's identical to interstitial cystitis. When you have urgency, frequency, you have to go to the bathroom. If you don't go, it's painful. When you start to feel that your bladder is filling up, it's painful. And the pain is on the lower abdomen. And the bladder nerve is so much connected with the muscles of the pelvis. And pretty much that for those who have bladder pain, you'll find them, they have muscle pain. And so that to treat the bladder, we use instillation, make sure the patients stop eating all this irritant. And it also involved with allergy, seasonal allergy, because the histamine is an inflammatory hormone. And when they circulate to the bladder, it makes the bladder hurts. And the muscles, when they're connected with the bladder nerves, you need physical therapy to really relax it. And so when the muscle hurts, if they pinch on some of the nerve, then the pudendal nerve pain started. So when the nerve pain is always there, and here you get a menstrual cycle with cramps, you see how that goes? Once it started, it becomes a big circle. It never stops. I hope that answers the question, because it just, one goes to the other, goes to the third and fourth, and then they're just like a vicious cycle.
So, Doctor, I think we hit this already. Does pelvic pain disorder cause pelvic muscle pain? And can you tell us more, or did you hear in this?
I think I shared with that already, because of the bladder nerve is tied to the sacrum. And the bladder nerve also tied to the lower lumbar on thoracic. For the sacrum, all the nerve in the sacrum tie right into the muscles. And uterus is in our pelvis, and also innervated by the sacral nerve or the lumbar nerve. They have referral pain. And when one started to hurt, the nerve pain and signal, it's like a river. When you have flooding, all the branches opens up. So the nerve signal is the same. When there's so much stimulation, all the peripheral nerve, they are just open up all the channel, and the pain just started that way.
So do women also have vaginal pain with this?
Well, yeah, they call that vaginal pain or pelvic pain or low abdominal pain. And that's the symptom. And the vulva, which is the opening of the vagina, some of the pain of the vulva is actually the pudendal nerve pain, or sometimes it's the bladder pain connected with it.
So if we solve the problem with the connection with the brain, are we 90% home here or not?
A part of it, you still have to treat the local neuroinflammations, like that particular nerve at in the pelvis. Most of the nerve in the pelvis, the nerve in the pelvis that involve most frequently are the pudendal nerves.
Sounds like a fairly miserable disorder.
Well, let's say I give you a case that I have a patient here in the past, that she is in her 40s, and when she was in her 20s, she has this pelvic pain. And so she went to see the gynecologist. The gynecologist did a laparoscopy, which is the telescope surgery looking for the pelvis. And after the surgery, her pain got worse. And she started to have pain on the left side. She could not walk. And her menstrual cycle pain was getting worse. Then she had pelvic pain, then started, and painful sex, and everything started 20 years ago. So when I first saw her, she could not even walk very well and walk tiptoe. Well, come to find out that she had menstrual pain, but then the surgery created the nerve injury on the lower abdomen. And then she had a hysterectomy. So when you have injury from the nerve, injury from the surgery, injury from the hysterectomy, then her pain is like a flooding and all the nerve channel just all open up. And it took me a while to figure out which is the nerve that was in trouble. So besides I treat all the pelvic nerve, and I have to treat the nerve that was injured during her first laparoscopic surgery 20 years ago. And now she could stand up straight with her leg. Of course, for 20 years, all of a sudden you don't see her walk tiptoe. And it's a big improvement. But because of the muscle was weakened for 20 years, she needs a lot of physical therapy.
Jeez. Okay.
Wow.
Okay, time for our final break. You're listening to Health Matters at the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us. We're talking with Dr. Maurice Chung today. Let's get back to the last segment of the show. So I think we're on the bottom. You're up, Brad. Something about nerve pain.
All right, doctor. You've mentioned nerve pain is related to chronic nerve disorder. Is there anything else you'd like to add based on what we talked about so far, or should we move on?
Well, I think patients with chronic pelvic pain and painful sex, they need to pay attention to the muscles and the pudendal nerve. And that's what I could add to it. And also to try to figure out whether they have any previous fall. If they injure the sacrum in the back, those nerves are actually the branch of the front branch. The front branch is the pudendal nerve. The back branch is the sacral nerve in the back. So you think about if you hit your back, right, sit on your tailbone and all this pain signal will start in the back and go to the front. So that could be the sentinel event of everything else just all of a sudden just catch the fire and start burning.
So I just had another question come through on a private message, and it's related to the painful sexual intercourse. Mm-hmm. And the question's related to, the patient said that she kind of felt that painful sexual intercourse was a problem with her personally. It wasn't necessarily related to a chronic pelvic disorder. Is that something that you have dealt with before? Because it sounds like from the way her question's worded that she feels like it was something wrong with her. It wasn't necessarily a biological system that was causing this result. Does that make sense?
They could think that way. And let's say if when a patient complains of painful sex, there are so many things that could go wrong in the pelvis. Some of those just have previous childbirth, and that the muscle and nerve fibers were injured and they have pain, and those pain never went away. So when you have sex, you hit that spot, it's painful. Sometimes it's jabbing pain. If they have the bladder component, that could be the bladder, because the bladder is the biggest pelvic organ. It's covered the entire roof of the vagina, so sex could hurt. Same for muscles. And muscle spasm could be from so many reasons. Sometimes patient might have some previous unpleasant encounter, and so they're fearful of sex, and the muscle spontaneous and I have muscle spasm, and it still can be treated. So it's the muscle disorder along with the nerves. So there's a pathology to that, and it's very easy to figure out what part of the system if you seek medical treatment. However, the sad thing is when a patient thinks that they have painful sex, that immediately tie right into endometriosis. And then you have multiple surgery and not dealing with the actual problem. Sometimes it's just the muscle spasm. So muscle spasm can be treated.
All right, very interesting. Thank you for that.
So if you're experiencing some of the common symptoms of chronic pelvic pain disorder, how do you know when it's time to see a doctor?
Pain is no good. There's no reason any woman would need to suffer from pain below the belly button. And when the pain bothers you and they never went away, then it's the time to seek out medical profession to help you. And you see, death is something that once you die, everything is gone. From most of the disease when causing chronic illness and yeah, you pass away, it's gone. But pain is worse because you suffer every single day and you're not gonna die from the pain. So that's the problem. That's a chronic suffering that never go away. So the sooner you find a doctor to take care of you, that acute pain is treated before it turns into a chronic pain. You see what I'm saying? Means that the sooner you deal with the pain, the earlier you can get relief before the nerve getting to be too crazy. That's the time. Once you have it, it doesn't go away for a few months. You got to go find a doctor. Don't let it wait for years. It's not normal.
Pretty interesting. Okay. If chronic pain disorder is left untreated, what can happen? So we just live with it, you know?
Well, the thing is, I've seen patient could not walk. I've seen patient could not sit. And the chronic pain affect the whole family. Let's say if the mother is having pain all the time, it affects the husband. There's no relationship. The children also be affected because mother is sick all the time. And if they ever happen to get onto the pain medicine, then they become dependent on the pain medicine. So how would that affect just the person? It affect the entire family. That's the problem too. And all these patients, they really drain the medical system to a certain extent because most of our money that we spend, a lot of those patients spend on the pain patients. And they have multiple surgery, use a lot of medication, have seen a lot of doctors. And so that is why that it's not good not to find doctor to help you. And when you want to find doctor to help you, find those who have the experience that deal with the chronic pelvic pain.
So we can't really solve this with over-the-counter pain relievers, the
No.
Tylenol of the world and stuff like that.
No, not at all. I mean, I can't say that it's absolute.
Yeah.
It's like a bell curve. You get the worst one, you get the better one, you get the one that's so mild. Mm-hmm. So, however, the sooner you deal with it, the better it is.
Doctor, can you share with our listeners today how to get in touch with you and your practice? So if they have more questions or need to seek treatment, that they can get in touch with you?
Yes. The Mercy have the Mercy website, and I think it's www.kenmercy.org. Then you can find me there. And I do have a Facebook page. And every now and then I throw out some Instagram because I'm so new at that and try to figure out how to share my information with the patient. Because the most important thing I want the patient to know, endometriosis surgery, you just need once. You don't need twice or 3 or 4 times. And hysterectomy is not the cure for endometriosis. And endometriosis is not all the pain, and they have other stuff. So you get onto the website. My office number is 330-489-1379 and 330-489-1379. That's the office number.
Okay, Doctor. Thank you very much to our guest, Dr. Maurice Chung, Director of Mercy Center of Endometriosis, Pelvic Pain, and Urogynecology at Mercy Medical Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider, as Dr. Chung said. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course, our technical producer, J.D. DeAngelis. As always, we thank your listeners for joining us on Health Matters with the Medicine Center Pharmacy.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts,